Hello, I'm Dr. Andrew Neville, and I specialize in treating adrenal fatigue. But today I want to talk to you about depression. Depression is a really key symptom that most people who develop adrenal fatigue deal with. Depression and anxiety as well, they have this connotation in our society of being purely psychological problems. And sometimes there is, right? People definitely deal with clinical depression and they need conventional workup, psychiatrists, therapy, things like that. But there is also the fact that too much stress hormone over time hits the brain and causes depression. Even in rat studies where they put rats under a model that they call chronic, unpredictable, mild stress, over time, those rats will develop a depressive affect, right? So is that a psychological problem, or is that more of a physiologic problem, a biochemical kind of a problem? There are many reasons as to why chronic stress over time, right, which is kind of what we refer to as adrenal fatigue, can contribute to depression. And I would suggest that actually the number one cause of depression in our society today is too much stress over time. Depression is so prevalent even that it's one of the number one things that people seek disability for nowadays. There's a difference. Some people try to blame the adrenal fatigue or chronic fatigue syndrome on depression. It's not chronic fatigue, it's depression, right? So there is an association between pretty debilitating fatigue and depression. But what we tend to mistake is kind of causation for correlation, right? You can tell somebody who has clinical depression from somebody who has chronic fatigue or adrenal fatigue. Just ask them one question. What would you do if you were better? Somebody with clinical depression, they can't answer that question, right? They'll kind of vacillate and hem and haw, like maybe I'd do this, or no, I don't know, maybe. But if you ask somebody with chronic fatigue or adrenal fatigue, what would they do if they're better? I mean, you better have an hour to sit back and listen to this laundry list of stuff that people want to do. When you fix this physiology, that is absolutely key in getting to depression. By the time my patients come into me, they've tried your typical depression treatments, whether it's serotonin support, 5-HTP, and tryptophan, all these various things, limited, maybe temporary results. The key really that I've found to lift depression over time is to shift this physiology, treat that underlying problem, and then the symptom of depression, okay, just like a lot of the other symptoms associated with adrenal fatigue, they will gradually improve. Those symptoms will gradually go away in time. So focus on the cause, right? It just might not be what you've been told. Good luck.